is fat cells, then there is the risk, the associated risk of obesity starts in the human body. So based on this body mass deposition, body mass increment, scientists have calculated or have been defined the body mass index for healthy weight. Then the formula given is body weight in kilogram divided by meter square. And if the range is between, if it is below 18.5, and the index is called underweight. Okay? And if it is range up to 25 kilogram from 19 to 25, then it is healthy weight. Okay. Then if it is more than 25 up to 30, then it is overweight condition. Then if it is more than 30, if the index is more than 30, then it is called the obese condition. So BMI is intended for those years, 20 years or age and older people, right? यो चाहिँ खास गरी 20 वर्ष भन्दा माथिको एजको मानिसको क्याटेगोरीमा we defined or we used to scale out the BMI or the body mass index for healthiness or to measure the obesity directly without any biochemical test. Okay, so in women there is two concepts very popular for making for maintaining the body weight. One is apple shaped and another is the pear shaped. So when the excess body weight results, then the body becomes pear shaped, and there is unbalance of regional fat distribution, and the weight gain pattern is also unbalanced, and these all would be resulted out due to sedentary lifestyle. Right? If you are sedentary or if you don't do at least 4 hours of exercise per week, then the woman's body might result to apple shaped, and this is not desirable. Okay, so again, there is a study in the United States. The journal says it is estimated that 280,000 to 325,000 deaths a year can be attributed to obesity in the United States. And more than 80% of those deaths occur among individuals with BMI greater than 30 kg per meter square. Okay, so there is a saying that how much people are dying in India due to hunger, the same number of people in the United States are dying due to obesity problem. Right? So obesity is a major cause of the United States population. Around half of the population is obese. Okay. So mortality, then let's go to the regional fat distribution to talk about the android body shape and the gynoid body shape. Okay, android means apple shaped and gynoid means this pear shaped. Okay, and this may be due to the regional imbalance of fat distribution, and which may lead to mortality. And this concept was first began in 20th century. Okay, and obese people have most at all the risk of diabetes and heart disease. Right? So my diabetes parauna, that is more related to insulin inactivity, and there are type 1 and type 2. Okay, and heart disease, this we will discuss now. And this android fat distribution results in higher fatty acid levels, free fatty acid levels, higher glucose and insulin levels, and reduced high density lipoprotein levels. That means the LDL is increased, but our LDL to SDL ratio is increased. That remains, that keeps people unhealthy, or that is the mark of the obesity, and it also results in higher blood pressure. So obesity is linked with diabetes, that may be linked with heart disease, and heart disease may be further impacted by high blood pressure. Right? They are the impact of obesity. So let's go to again. Then this sedentary lifestyle is the main reason of this obesity in most of the global population. And if the body mass index is less than 25, that's okay. But obese man with a high level of fitness, high risk of death, that way not different from fit men with normal body weight. If obese man looks healthy, even he has a high risk of death due to heart disease, cardiovascular attack. Okay. Then the next, there are some other morbidity terms related to obesity. One is obstructive sleep apnea, osteoarthritis. It has no medicine. You can just make precaution of it. Cardiovascular disorders, gastrointestinal disorders, and metabolic disorders, for example, diabetes and thyroid, high thyroid or low thyroid condition. Then endometrial, prostate, and breast cancer, the complication of pregnancy, the menstrual irregularities, and the psychological disorders. So even though we don't talk the psychological disorder and menstrual irregularities, but the first 5 diseases we might talk today. So let's go to cardiovascular disorders associated with obesity, and mostly we talk about hypertension, stroke, and CAD or CVD, coronary arterial disease, CAD, not CVD. Okay. So hypertension is the term for high blood pressure, and it is a result, a symptom of high blood pressure. When hypertension is identified, then its diastolic and systolic unit is increased more than 140 to 90 mmHg. And high blood pressure is known as the silent killer, since there are usually no symptoms with hypertension. And some individuals find out they have high blood pressure when they have trouble with their heart, brain, or kidney. So hypertension is also related to the brain stroke and the kidney damage, kidney failures. Okay. So there are some symptoms of the hypertension. One is heart failure, then small bulges to form in the blood vessels, blood clotting. Okay. Then blood vessels in the kidney to narrow, which may lead to kidney failure. Okay. Then next one is the stroke and amputation. Okay. And amputation meaning
sir?
Amputation implies due to high blood pressure and hypertension, your body limb sometimes stops to work. Okay. It may be it look like a paralytic symptom, and you need to cut off the body part. This condition is known as amputation. Okay. Then blood vessels in the eye to burst or bleed, and this may cause vision impairment and sometimes leads to blindness. Actually, high blood pressure they have a chance for paralysis and this blindness. Okay. So normally this hypertension is results due to thickening in the wall of the ventricles. Okay. Just a normal artery, wall thickening ventricle go. Hypertensive heart, it is very thick due to much deposition of fatty acids, cholesterols. Okay. Then blood pressure is often increased in overweight individuals, and in the African Americans, it suggests the control of overweight would eliminate 48% of the hypertension in Caucasians and 28% in the Americans. That means this hypertension, the risk of hypertension is also sporadic to the population race. It is not similar. Okay, then overweight and hypertension interact with cardiac function, leading to thickening of the ventricular wall and larger heart volume, and thus to a greater likelihood of cardiac failure. The heart volume bursts, then it needs to pump out more oxygen, and it needs to pump out more blood. Okay, so then let's go to stroke. And stroke occurs when the blood supply to the part of the brain is suddenly interrupted by blocked vessel, or when the blood vessel in the brain bursts. Okay, this is called stroke. Stroke when you brain ma blood vessel burst or it is blocked. Okay, once the oxygen supply and nutrients from the blood is cut off, then brain cells start to die. And this condition is almost very common in the modern people. Okay, stroke is very common. Then there are sudden symptoms, initial symptoms of a stroke, numbness and weakness, and sudden confusion or trouble speaking, and sudden trouble seeing, blurry dekhne, then sudden trouble with walking, dizziness, or loss of imbalance or coordination. Your body part then sudden severe headache with no known cause. They are the causes of the stroke. So there are two kinds of stroke we normally speak out in health science. One is ischemic and second is hemorrhagic. The ischemic stroke occurs when an artery to the brain is completely blocked. Okay. Then while these hemorrhagic strokes occur due to blood vessel in the brain is burst and it is erupted. So overweight and obesity do not increase the risk of hemorrhagic strokes. Ischemic matre ho, ischemic stroke it is related to food intake and nutrient density intake, while hemorrhagic stroke occur it is not due to obesity and obesity. So then let's go to CAD, and it is very common terminology used in food science and nutrition, and is a type of atherosclerosis that occurs when the arteries supplying blood to the heart muscle become hardened and narrowed. Okay, your brain ko attack say stroke ho, the heart ko attack say it is CAT. We say coronary arterial disease. And when these blood vessels are hardened and it is narrowed, and due to the thick plaque build-up of the fat deposition. And as the plaque increases in the size, the inside of the coronary arteries get narrowed, and eventually blood flow to the heart muscle is reduced, and at the meantime the blood pressure increases. Okay, and this is the critical condition because blood carries mass oxygen needed to heart and from heart to other body parts. This is the pathway that may lead to the numbness and these paralytic condition of certain body parts, or you need to do some amputations. Condition. Okay. Then there are two aspects mostly people talk on coronary arterial disease. One is angina. It is simply the chest pain and the heart attack. Okay, in all kind of angina, they don't lead to heart attack. Heart attack means simply it is blockade to bring the oxygen and blood to the heart. For angina, it is initial symptom of heart attack. It is simply the chest pain. Okay, then over time, the coronary disease can weaken heart muscle and would lead to heart failure and arrhythmiasis. That means arrhythmiasis means changes in normal beating rhythm of the heart. Your heartbeat can fluctuation, right? Okay. So then the next is the coronary artery disease also increase the risk of fat deposition in the kidney, and that in the retroperitoneal area. Right? Your kidney ma pani yesko चाहिँ के भन्छ deposition हुन थाल्छ. Then also it increases the risk of colon cancer and the gallstones. Gallstone we will talk. Okay, then let's first talk to the colon cancer. And the colon cancer is a term used to refer to cancer that develops in the colon or the rectum. And the colon is about 5 feet long, and its role in the digestive system is to continue to absorb water and minerals and sometimes vitamins from the food. And once this process of absorption complete, waste matter remains in the large intestine. Okay, and the rectum is the final 6 inch of the digestive system. It is only 6 inch. Rectum large intestine ko antim part ko 6 inch ko bhagलाई rectum bhanincha, and feces are passed from the large intestine to the rectum to exit through the anus. So it is mostly due to the less intake of the dietary fiber in the diet. and it is estimated to cause about more than 55,000 deaths during 2006 in the United States. Okay, colon cancer is related to high calorie food but less intake of dietary fiber. So then colon cancer has been shown to occur more frequently in people who are obese than in people who are of healthy weight. Okay, then an increased risk of colon cancer has been consistently reported for men with high BMIs, more than obese condition. Okay, so women with high BMI are not a increased risk of colon cancer. Okay, यो चाहिँ मेनमा भन्दा के अरे वुमेनमा भन्दा मेनमा कोलन क्यान्सरको इफेक्ट बढी हुन्छ, प्रोस्टेट क्यान्सर मेनमा बढी हुन्छ है, ब्रेस्ट क्यान्सर वुमेनमा बढी हुन्छ है. ओके, so then another one is this gallstone, or we say this gallbladder disease, and normally this condition we say the cholelithiasis is a primary hepatobiliary pathology condition. Okay, and in this condition, this deposition of this fat in the gall starts to consume or to collect bile salts, and these salts become harder at the end, right? And this condition becomes solid, and we say, and it forms as a stone. Okay? This is also due to deposition of fat in the cystic duct or in the gallbladder. Okay? So, and it is our stone, gallstone. This is due to mass deposition of fat, and fat starts to collect bile salt, and finally it becomes solid as a stone. Right? And it is due to mass deposition of cholesterol. Right? So, cholesterol is the main cause of higher BMI, and that may risk again the gallbladder. Then there are some findings related to gallstones. Then obesity appears to be associated with the development of gallstones. That is clear. And more cholesterol is produced at higher body fat levels. Okay, mostly from intake of fat from the animal origin, butterfat, ghee, or some other animal fat-derived foodstuffs or included foodstuffs may increase the risk of gallstones in obese people. Then approximately 20 milligram of additional cholesterol is synthesized for each kg of extra body fat. This is the reason, main reason, okay? Then high cholesterol concentrations related to bile acids and phospholipids in bile increase the likelihood of precipitation of cholesterol gallstones in the gallbladder. जति धेरै कोलेस्ट्रोल जम्मा भयो त्यसले त्यति नै धेरै बाइल साल्ट चाहिँ एक्युमुलेट गर्छ. Okay, then that forms to the gallstone. Then there are many other findings for in men and women, and it says women with a BMI more than 30 kilogram per meter square had a twofold increased risk of symptomatic gallstone. And there is also the finding says women with a BMI less than 45 kg, sorry, more than 45 kg per square meter body BMI had a 7-fold increase risk for symptomatic gallstone. That means if the BMI is increased by 50%, there is 7-fold increase in the 50%, then there may be higher risk of symptomatic gallstone formation. So the relative risk of symptomatic gallstone development with increasing BMI appears to be less for men than for women. Okay? Gallstone chance women ma badi huncha. Okay, there are some other findings to obesity and gallstone, and weight loss leads to an increased risk of gallstone. One, diet with moderate level of fat that trigger gallbladder contraction and subsequently emptying of the cholesterol content may reduce the risk of gallstone formation. And bile acid supplementation can be used to lower one's risk for gallstone formation. Okay? जब सारले बाइल एसिड चाहिँ एक्युमुलेट हुँदै जाँदा गलस्टोन फर्मेसन हो भने बाइल सालको इन्टेक बढाइदियो भने चाहिँ that increases bile acid supplement that increases that lowers the risk of gallstone formation. So there are other metabolic disorders associated with obesity. One is diabetes. Secondary is the fat deposition in the skin. We simply say dyslipidemia. And third one is this liver cirrhosis. We simply say the liver disease. Okay. Let's go to diabetes, and it is diabetes mellitus is strongly associated with overweight and obesity in all genders and in all ethnic groups and from all regions. Okay, and mostly the risk for type 2 diabetes mellitus increases with degree and duration of overweight in many individuals. And there are two kinds of diabetes. Normally we spell out. One is type 1 and the type 2. In type 1, this is mostly appearing in some children underage condition, while type 2 may occur of the age and older people. Right? So the risk for type 2 type 1 there is no production of insulin at all, and put in type 2 there is high resistance to insulin. Right? Okay, the basic physiology of diabetes is insulin is the driver to open the gate of the cells to enter the glucose molecules, right? Sugar molecules. Right? त्यो काम चाहिँ हुँदैन डायबिटिजमा. त्यसैले उसको ब्लडमा चाहिँ सुगरको लेभल बढ्छ है, एन्ड सेलमा चाहिँ जान पाउँदैन क्या. Sugar metabolism चाहिँ it is partly controlled. Okay. And the risk for type 2 diabetes mellitus also increases the individuals with more central distribution of body fat. जसको त्यसपछि के हुन्छ तिम्रो बडीको एनर्जी मेटाबोलिजम ग्लुकोज हुँदैन, it is fat then, है. जब फ्याटको मेटाबोलिजम बढी हुन्छ there is imbalance in the regional fat distribution, है. Basically abdominal fat is increased. So there are also relations between obesity and type 2 diabetes, and among the people diagnosed, the reference I added from obesity in America.org. Then it says among people diagnosed with type 2 diabetes, high BMI more than 30 or equal to 30, high BMI 25 or 30, 25 to 30, and overweight, and based on the BMI अनुसारको चाहिँ तिम्रो डायबिटिजको रिस्क हेर्यो भने चाहिँ it is high risk with obesity. Up to 55% populationमा चाहिँ total type 2 diabetes भएको populationमा चाहिँ it is mostly in the obese people, right? So there are some other findings related to obesity, and it says women with a BMI below 22 kg per square meter high lower risk of diabetes mellitus, and at a BMI of 35 kg per square meter of body weight BMI, the risk for diabetes mellitus increased 40-fold or 4,000%. Okay, so control of body weight is must be the goal to control the diabetes mellitus. And the health professionals follow-up study demonstrate a similar relationship between increasing BMI and the risk of diabetes in men with a BMI below 24 kilogram per square meter had a low risk of diabetes, while a 35 kg per square meter, the relative risk of diabetes mellitus increased 60-fold or 6,000-fold, 6,000%. That means the risk of diabetes mellitus due to obesity is higher for men than the women. Right? You can compare the database. So then there are some other findings in the health profession follow-up study. A weight loss of 15 to 11 kg decreased the relative risk of developing diabetes nearly by 50%. Right? Normally doctors recommend to reduce the body weight at least by 10 kilograms for diabetic people. Okay. Then type 2 diabetes was almost non-existent with a weight loss of more than 20 kg. It's heavy, but it is possible. Okay. Or in those with a BMI below 20. It is very hard work, but it is possible. So then another metabolic disorder is dyslipidemia, and this is defined as abnormal concentration of lipids or lipoproteins in the blood. Okay, this is because a positive correlation between BMI and triglyceride. अब हामीले cholesterol को condition पढ्यौं, right? Gall formation, and this is the condition of deposition of triglycerides. है जस्तो मिल्क फ्याट प्रोडक्ट बढी खानेहरुको चाहिँ यो ट्राइग्लिसराइड डिपोजिसन स्किनमा चाहिँ बढी हुन्छ है छालाभित्र चाहिँ सारो एउटा अन्डुलेटेड डल्लो पदार्थ चाहिँ जम्मा हुन्छ के है दिस इज dyslipidemia. Okay, then there is inverse relationship between SDL cholesterol and BMI, and this relationship may be more important than relationship between BMI and TG level. Right? Body में SDL छ भने dyslipidemia condition नहुन सक्छ, but if the SDL is low and TG level is high, then dyslipidemia is possible. And the central fat distribution also plays an important role in lipid abnormalities, and excessive body fat in the abdominal region leads to increased circulating triglyceride level in the blood. Okay, so precaution of dyslipidemia is to control the intake of milk derived fat. TG triglyceride fat, milk fat. Okay, you want okay. Milk fatty acid हो तो चाहिँ बढी हुन्छ. So then another symptom is non-alcoholic fatty liver disease. It is due to the abnormal condition of fat liver due to more fat deposition in the liver. And in a cross-sectional analysis of liver biopsies of obese patients, it was found that prevalence of steatosis, that means liver hardening, and steatohepatitis, hardening, and this infection, and cirrhosis. It means where exponent is 75, 20, and 2% respectively. So in cirrhosis, it is kind of final hepatitis. Okay, steatosis liver hardening matre ho. Okay, then there are. Let's go to steatosis. Is the fatty liver, and it is actually a disease, but rather a pathological finding. Liver muscle hard on the and the increased risk are diabetes, certain drug liver hardening on the fatty liver on and intestinal bypass operation nutrient we bypass through liver, and there is possibility of steatosis, and too much starvation, there is possibility of steatosis, and protein malnutrition हुँदा पनि स्टेटोसिस हुने चान्स हुन्छ र टु मच अल्कोहलको कारणले त लिभरको डिजिज भन्ने सामान्य भएको. ओके, देन लेट्स गो टु अनदर वान इम्पोर्टेन्स अफ हेल्दी लिभर है, बिकज लिभर इज वान अफ द लार्जेस्ट ग्ल्यान्ड इन आवर बडी द्याट रेगुलेट्स 3000 billion of cells of the liver. These billion cells involved in metabolism. And during the metabolism, the liver breaks down nutrients to usable products. And these products are then delivered to rest of the body through bloodstream as a nutrient. And the liver also metabolizes toxins into byproducts. Our liver has a major role to neutralize the toxins that we inhale through the food intake. Then liver is also the house for production of many immune substances, so albumin, bile, and cholesterol, because cholesterol is needed to form the vitamin D, and blood clotting factors, and globulin, and immune factors. Right? It is the host for all kind of matter. It is the center of metabolism. So then other symptoms associated with this obesity are obstructive sleep apnea, osteoarthritis, the form of cancers, and complication of pregnancy, menstrual irregularities, and psychological disorders. Okay. Then obstructive sleep apnea is caused by repetitive upper airway obstruction during sleep, and as a result of narrowing of the respiratory passages. Right? Patients having a disorder are often overweight and associated with peripharyngeal infiltration of fat and increased size of the soft palate and tongue. Right? राति घुर्ने समस्या जसको छ नि मोटो मान्छेहरु, this is we say obstructive sleep apnea. Right? Then it is a common complaint and that results in the loud snoring, disrupted sleep, and excessive daytime sleepiness. Right? Due to apnea, and individuals with sleep apnea suffer from fragmented sleep and may develop further the cardiovascular risk because of the repetitive cycles of snoring and or due to the airway collapse and arousal. Then because many individuals are not aware of heavy snoring and nocturnal arousals, obstructive sleep apnea may remain undiagnosed, right? But it is related to obesity. Right? So, global data and obstructive sleep apnea affects around 4% of the middle-aged adults, and individuals having a BMI of at least 30 are greater risk of sleep apnea. And weight loss has been shown to improve the symptoms relating to sleep apnea. So another problem is osteoarthritis, konjo etai dukhन्छ, konjo utai dukhन्छ. This is a kind of a bone, this is joint pain. We normally say osteoarthritis, and it is common type of arthritis in the global population. And it is a degenerative disease. That means it is mostly prevalent in the old people, when the age is over 65, and currently only the symptoms of this osteoarthritis can be treated, but it has no permanent medicine to cure. Okay, so it is just a precaution, some physical exercise, or to reduce the BMI is, or might be a goal to control to prevent osteoarthritis. So, okay, then there are some findings related to osteoarthritis, and it is related to overweight, and osteoarthritis develops in knees and ankles, and you can say in most of the body parts where you can feel pain. Okay, in the neck, in the thighs and thigh joints, are these pain in the stomach also due to too much pressure to the stomach, and knee joint, and the pain in the hand and the finger joints. Okay, this is also affected, and it mostly affects the cartilage and bone metabolism, and independent of the actual stasis of body weight on joints. Right. So then there are also related findings of obesity and cancer. I think we did yesterday for it. There are also some endocrine changes with obesity that we say diabetes. Okay, this is endocrine changes, and changes to thyroid hormone level. Okay, these are the endocrine changes associated with this. And psychological disorder, we have no importance. And in conclusion, there are this list of these effect of obesity: diabetes, hypertension, gallbladder, liver disease, many types of cancer, coronary arterial disease, and stroke. Some endocrine changes that leads to, and these, but they are not related to associated with increased fat mass. Right? Already, part disease they are increased with the fat mass or the obesity. So, maybe tomorrow we'll do the final lecture. Right? Our final preparation for internal assessment and final handout. आज यति गरौँला है। मैले पढाएको थिएँ के भन्छ न्युट्रिसन एन्ड के रिस्क भनेर हैन, हेल्थ रिस्क. सो health risk is mostly associated with obesity, right? And control of obesity or control of fatness should be targeted other than control of disease itself, right? And our gastrointestinal disease, urolithiasis, र अर्को एउटा बाँकी छ त्यो चाहिँ अहिले त्यो टुमोरो चाहिँ हामी फाइनल एक्जामको तयारी मात्रै गर्छौँ. देन वी डिस्ट्रिब्युट ह्यान्ड आउट the new presentations which I have prepared and sharing of these all resources. Then we will close it tomorrow. Hey, look, as I think tomorrow we will meet at the same time.
Okay, sir.